Okay, so these are some clinic level settings and preferences that you can set that affect all users. So now we're going to pivot and we are now going to go to user level preferences, which means that you can technically override some of the clinic preferences. So if you click, we're back on the schedule view. So now if we click on preferences, we're going to have this beautiful pop-up window. I have qualms with how it's organized and how it looks, but I feel like Oscar is quirky in its own way. I use Control F a lot in Oscar or Command F if you're on a Mac. And so what I'm going to do is just type billing, and then it'll automatically jump you to that section of the window. And I'm going to do edit billing preferences. So right now we have clinic default set at a user level. But Danielle just made a really nice billing form and I want that to be my default. So I'm going to copy Danielle's homework and I'm going to select LFP, Dr. Danielle, because I'm also, let's say, on the LFP model, and I really liked how she organized her billing form. So I'm going to make this as my default now. You also can make default provider as your billing provider. So this could be interesting in terms of you have like an MOA physician relationship. So if you are billing for yourself, you can make yourself as default. But let's say you're an MOA user that is supporting one physician, maybe you can also make the billing provider as like a specific physician. Service location is currently the clinic default, but like most providers sometimes don't know what the clinic default is. So if you want to just, for your own reassurance, manually set that for yourself, you can also select the service location code or confirm with your clinic manager or medical office assistants, as well as default payee. So again, depending on how your clinic has their setup for payments, but if you want to select your default payee, then you can do that here. So these are some key of the user-based preferences that might be helpful, but main one that's quite handy dandy is selecting your default billing form. So now I'm going to click on save. So now that's done. If I close these windows and I go to create a bill, it's now automatically using Danielle's form. I really do like optimizing the use of billing form management, like Danielle had highlighted. It's a good way of categorizing the most commonly used claims that you use. So definitely good to review what's currently in your EMR, and if what you currently have in your EMR doesn't quite meet your needs, to be able to create a net new one for yourself.